The history of radiology all started with a man by the name of Wilhelm C. Rockton in 1895. The X-ray of his wife's hand is known to be the first image of its kind. Since then, radiology has curated into more energy forms for imaging. This technology can be seen when using a fluoroscopy for an open reduction internal fixation in order to repair it. Although the concept of an open reduction internal fixation dates to the early 1800s, it was fully documented in the 1880s and 1890s. It has since been improved and modified by using many different radiologic techniques. Open reduction internal fixation, or ORIF, is an operation that uses surgical hardware to stabilize a fracture beneath the skin. First, an incision is made over the fracture. Then the muscle and tendons are carefully moved in order to gain access to the bone. The fractured bone is realigned and secured together with surgical hardware. Lastly, the muscles and tendons are placed back into position and the incision is closed. There is then aftercare that is appointed by a physical therapist in order to regain movement, strength, and function. This procedure is important when it comes to angles and guiding, which is why it goes hand in hand with radiologic sciences. Open reduction internal fixation is linked to radiology because of the use of a fluoroscopy during the procedure. A fluoroscopy is a type of medical imaging that shows a continuous live X-ray on a monitor. This type of imaging mimics an X-ray movie. During a fluoroscopy, an X-ray beam passes through the body. The image is then transmitted to a monitor so that you can see movement in detail. This type of medical imaging helps during an ORIF by guiding the physician to treat the fractured bones and placing surgical hardware at the right angles in order to heal properly. Once the fracture has healed, should the surgical hardware be removed? This is an ongoing question according to studies. Although the hardware removal is commonly performed, there has been cases in which it's not needed. The studies go back and forth to whether patients encounter more pain with the hardware in or out. In the National Library of Medicine, there is a study that concurs most patients have more comfort without their surgical hardware and would recommend that others get theirs removed. Nonetheless, it is always up to the surgeon and patient in their specific situation. For example, my roommate had the option to get her screws removed from her femur, but postponed until she felt discomfort from them because she wanted to avoid the unnecessary surgery. In conclusion, radiology has come a long way since Rockton's first X-ray of his wife's hand. Techniques such as open reduction and internal fixation are happening every day and tie heavily into the radiologic sciences. With the help of the fluoroscopic technique, bones are being secured into place at the correct angles using live X-ray imaging. After physical therapy and once a fracture is completely healed, the surgical hardware that was used may or may not be taken out depending on the surgical plan and patient preference. This entire process showcases the importance of radiology even in medical fields where you might not expect it.